I am the nurse practitioner and clinical service line director for Appalachian Regional Healthcare and our new service line called Lifestyle Medicine. So as we know, ARH provides care all across Central Appalachia with 14 hospitals. You know, we provide a large number of jobs for multiple employees across our system, and that includes both Kentucky as well as here in West Virginia. While we are committed to taking care of men and women across our system while they're sick, we also realize the great importance of taking care of them while they're healthy in order to reduce their risk of chronic disease, such as heart disease, diabetes, hypertension, obesity. Just as a raise of hands, how many of you know someone with a chronic disease, high blood pressure, diabetes, hyperlipidemia, or high cholesterol, or struggle with their weight? Well, then that stems this other question. How many of those conditions are driven by how we live every day? Most of them have a lifestyle factor associated with the risk, such as how we move, or if we don't move, what we eat, how we manage our stress, how we sleep, any positive social connections we have, or use of risky substances. 6 in 10 adults have at least one chronic condition. They are largely driven by lifestyle patterns such as ultra-processed diets, sedentary behaviors, poor sleep, chronic stress, and social isolation. This is where lifestyle medicine comes into play, and this is just a little visual again to show you the rates of chronic disease. This is from the American College of Lifestyle Medicine. You can see that most causes are from lifestyle behaviors. So, what is lifestyle medicine? Lifestyle medicine is a medical specialty that uses evidence-based therapeutic lifestyle interventions as a primary modality to treat chronic diseases that we mentioned earlier, such as obesity, prediabetes, diabetes, high blood pressure, other heart diseases, obesity, like I said, and not limited to other diseases as well. Since starting the service line, you know, I have had a wide range of patients come in with different health concerns that I'm able to work through with them that's not listed in this chronic condition. Lifestyle medicine is based on 6 major pillars, and you'll see those listed here, including nutrition, physical activity, restorative sleep, stress management, avoidance of risky substances, as well as positive social connection. And we create plans of care to meet that patient where they are to reach their health and wellness goal. This helps us as clinicians treat the person as a whole. I always say it's whole person care, right? If we put those 6 pillars on a wheel, if one of those wheels falls off, everything else starts to fall off with it. So we want to treat the root cause of the disease. Here's where things can get exciting in healthcare. With lifestyle medicine and the wellness approach, we can actually improve and often even reverse chronic disease with just lifestyle changes. Examples include improved insulin sensitivity with nutrition and movement, as well as improving daily energy by restoring adequate sleep. We know a diet high in ultra-processed foods aren't healthy, right? We also know that a sedentary lifestyle can increase our risk of chronic disease. So why not start there? As Americans, we lean towards diets high in ultra-processed foods, added sugars, red meat, etc. We are also all more sedentary than maybe we were 20, 30 years ago, with use of virtual visits for healthcare providers, with use of Teams meetings and Zoom meetings since COVID. We're all way more sedentary than probably what we were even 5 to 10 years ago. But by adding in small habit changes each day to lean towards a whole food nutrition pattern, as well as decreasing our sedentary time, we can make large leaps in our health. So speaking of habits, that is the basis of lifestyle medicine. I want to give patients small habits that they can utilize every day without feeling like they have to make these big leaps and bounds to make positive changes in their health. For instance, someone that may be interested in exercising and know the benefits, but they're not really sure where to start. I'm not going to have them go out and run a 5K right away, but that may be one of their goals, is to walk a mile. So we'll talk about ways that we can slowly build up to that. Or if they are an employee of our hospitals and they do shift work. I'm doing a lot of work with our community development teams as well as our employee engagement teams within ARH to address those problems for our employees, such as I don't have time to meal prep, or how can I make sure to get some steps in throughout my day? And we will just go through day to day of what that would look like. We set up every case as individual for the patient. I always like to say that with lifestyle medicine, the providers are just in the passenger seat and the patient is actively involved in their health. And we want to help improve their health, help them live healthier longer through lifestyle changes. So how can this not only affect our hospital system, but the community itself? We take lifestyle medicine into the communities by educating in schools, workplaces, churches, and other local community establishments. Health doesn't start in the clinic. It starts where people live, work, and raise families. Lifestyle medicine empowers individuals to be active in their care, like I mentioned earlier. This helps reduce our healthcare costs, improve quality of life, and long-term creates healthier communities. So what does this look like in real life? A client comes with the goal to improve their weight and reduce their risk of prediabetes. Instead of prescribing a medication and simply saying, okay, you need to eat healthier and start exercising. That's very overwhelming for a patient, and they may not know what that really means. So we meet the person where they are and discuss health habits in which they can reach that goal. We may suggest eating fast food less throughout the week. Instead of 3 times, can we cut it down to once? They're also going to save money by doing so. We also talk about where can you fit in exercise throughout your day. Instead of thinking you have to go to a gym for 30 to 45 minutes every day, maybe it's just a 10-minute walk after dinner or a 10-minute walk after breakfast. As you can see here, small shifts can lead to big outcomes long term. So why is lifestyle medicine the future? Chronic disease is our biggest health burden. Medication alone does not solve every problem. Absolutely needed in certain situations, but there are ways that we can reduce the amount of medications that patients may need long term. Our healthcare costs continue to rise. By educating patients, employees, and communities on lifestyle medicine and getting back to the root cause and whole person care, we can improve their overall health and longevity. And that is kind of lifestyle medicine in a nutshell. From the ARH system, we're very blessed to be able to bring this to our health system, and our goal is to expand that across our hospitals and our regions. So I would love to answer any questions if anyone has any. Otherwise, I highly encourage you, maybe after this, go outside and go for a walk because it is gorgeous out and you all have a beautiful facility, and just thank you so much for letting me be here today.
Thank you, Allie. Do we have any questions? I have a question. So physicians, as far as they're concerned, are they embracing this lifestyle medicine? Are you finding that?
Absolutely. So we definitely don't want to replace their primary care provider. I want to work with them. I just want to be that extra hand, that extra resource. All physicians and healthcare providers in general are very busy. They may not have time. Our visits in lifestyle medicine are about an hour. So they may not have the time to talk with a patient for an hour about, okay, what did you eat for breakfast? how much water are you drinking? How are you moving your body today to reduce your risk for chronic disease? But that's where I can come in and definitely, hopefully, make a positive impact on their health. And then we go back to their primary care provider when the time comes of, okay, we've repeated labs and we're seeing an improvement. I had a lady just yesterday, she was pre-diabetic, and within 4 months of us seeing her, she has now normalized her hemoglobin A1C with just lifestyle interventions. So we're definitely, hopefully, working as a partnership with those primary docs.
Thank you. Any other questions? All right. Well, thank you so much, Allie. I really think that, in southern West Virginia, we definitely see some worse health outcomes than the rest of the area and in eastern Kentucky. So we really appreciate ARH's efforts in addressing this. Thank you.